terminal knee extension. So we're using a resistance band, a longer loop style that is wrapped around a squat rack post. You can do this with a cable column as well. So like a cable column like this guy. If you have like an ankle cuff or some of those bigger straps that goes around your hips, you can attach to the cable and put it behind your knee. Most people at home are going to have limited equipment, so something like a band wrapped around some sort of a movable object works best, or even closed into the edge of your door. So what we're doing here is we're using this band to give us some resistance to be able to get back into full knee extension. And then we can change our off limb and change our foot positioning to kind of mimic those different positions of a gait cycle. So when we typically start, this is really common with people that we see for post-op Achilles or ACL, total knee replacements, someone that's had some quad dysfunction and trying to couple back knee extension. So the key here is to not let the glute take over. So when you're setting up, you want to make sure that your resistance band is set up at about knee height. And the first one that I like to do is having the foot forward. And the idea here is that when I'm bending both knees, when I go to straighten my left knee with the band, if I start to use my hip, oftentimes I'll lean forward or I'll hyperextend my low back. So getting a mirror off to your side, setting your cell phone up, videotaping yourself, or even putting your hand on your butt to be able to feel if your butt's firing is a really simple way to prevent that compensation from happening. And where you should feel this is down in those quad muscles or right above the knee itself. You shouldn't get a lot of pressure in the knee. If you get pressure in the knee, we're going to play with your foot positioning and the height of the off leg in order to take away that pressure in the knee. So another progression, or another movement position I should say, is feet side by side, doing the exact same thing. Slight knee bend all the way straight. Maybe put your hand on your glute to make sure that you're not compensating with your glute. And then I could put my right foot forward and have my left foot back, bend my knee, straighten my knee, bend my knee, straighten my knee. And again, all I'm doing is just simply trying to push all the way back into full knee extension, get my knee to lock out and feel that quad muscle working. If you have a hard time with that, or a way to make it to where you can feel your quad a little bit better, is by elevating the off leg. So if I take a yoga block and I throw it on the ground and I elevate my right foot, that's going to shift my center of mass or my balance back onto this stance leg, slightly bend my knee, straighten my knee all the way, focus on getting that quad to fire. The higher up I bring this leg, the more you're going to feel it in your glute versus your quad. So you got to be careful on your height that you don't get too high, so that way you're not compensating into this glute. If you just stand in this position with your knee locked out and then start raising your right leg, when your right leg gets about parallel to the ground, you'll feel the glute turn on. So that's why I like to use a yoga block. It's not something that's too high. Just going into that knee flex position, driving into my knee all the way straight. Now, if you're someone that's post-op and you're having some knee swelling, some stiffness, your tibial rotation is oftentimes limited, and that's what goes with knee extension and knee flexion. So when you're doing that terminal knee extension, sometimes changing your foot position can help alleviate that pressure. Or when you go to straighten your knee, you can simply rotate your torso over toward that leg that you're working and then straighten it, and it will create the rotation of the tibia on the femur. And you can do a couple reps like that, come back to the normal position, and then straighten your knee again, and oftentimes that pressure will be alleviated. So again, should be no pain in the front of the knee, a little bit of pressure depending on where you're at. If you're post-surgical, that may be applicable to you. But the idea here is that we can feel our quad working without our butt taking over.